as we are every week. We're happy to be joined again by Trinity Health of New England's Dr. Syed Hussain to talk about how we're doing on a number of fronts health-wise. Good to see you again, Doctor.
Morning.
Yeah, glad to have you here. Talking COVID again. Right now, XBB 1.5, the dominant variant. But I want to start over in China, where case numbers are exploding because they tried such drastic measures to stop previous variants from spreading. Question is an explosion over there going to make its way over here?
Yeah, that's a good question, Tim. So a couple things I want to remind viewers about why we're different compared to China. China has had a zero COVID policy, which meant a really strict lockdown. Campaign has really lagged behind. And as a result of these strict lockdowns, there has been not a lot of natural immunity to the virus. So that's why we see these skyrocketing numbers out of China. Now, what's different here in the U.S. is we've had a very successful vaccination campaign since December 2020. We have not gone into any lockdown since spring of 2020. There has been, we've encountered surges, which has actually led to natural immunity in parts of our population, coupled with vaccine-mediated immunity. So we do stand much better in terms of where we are compared to China. Now, what worries me, though, is the unchecked rise in cases in China may spawn a new variant, which is able to dodge immunity. So we always have to keep an eye on that.
Yeah, and we were looking at XBB 1.5, of course. It seems like every new variant more transmissible than the last, but looking at the number of hospitalizations, at least COVID-related, it's up close to 800 now in the state, which is rising, not nearly where it was this time last year. Deaths, too, starting to go up, but again, not nearly where we were this time last year. Is this good news? It's relative good news. Again, these numbers used to be 0 5 years ago.
Right. So initially when XBB 1.5 was detected, we thought it would become a nationally dominant strain. It looks like it's more of a regional strain in the Northeast in particular. It's driving these cases up. Whether we've reached a plateau, the coming weeks will tell, but it's definitely not the doomsday variant that initially folks were afraid of. But having said that, it's important that people get the bivalent COVID-19 booster. Nationwide, the booster rate continues to be low. It's around 15%. So what worries me as a physician is that vaccine-mediated immunity will wane. So we don't want to get to a point where these new subvariants are able to infect and get more people sicker than they should.
And it's really, I guess, showing us a sign that a lot of the previous immunity and the vaccination is really helping us, that China may not lead to a big surge here. They just decided to rip the Band-Aid off a lot later. I mean, you cannot avoid COVID entirely, but now we've got this reservoir of immunity that seems to be serving us well. Now, when you add it in with all the other viruses going around, I haven't looked to see just how overburdened our healthcare systems in Connecticut are. I'm getting the sense they're not, that we're still holding pretty strong.
We're able to take care of everybody who needs medical attention, medical care. And the good news is flu and RSV have started to go down nationwide. COVID has ticked up, but again, you know, those public health measures, there's 6 counties in Connecticut, for instance, that are now recommending indoor masking. So those public health measures are really, really important for folks to keep in mind as we get through this winter season. Yeah,
and you know, that's all right. I guess last quick question. Are we already past the point where we should expect to see any holiday-related rises, or might that still be delayed by another week or so?
It takes 2 to 3 weeks to start seeing a bump, so we're still in that period where we may be able to see an uptick in cases based on the holidays.
The uptick we're seeing now, of course, just because it's winter and these things do tend to happen. But so far, okay, we're managing it well, and we're doing a lot better than we were at least this time last year. So let's take that and go with it. Just stay safe out there. And of course, if it's your time to get a COVID booster, go get that booster. Doctor, good to see you again.
Thank you. Likewise.
Glad to see you again. Syed Hussain from Trinity Health of New England. Matt.